Hello and welcome. Today, we're delving into a common yet often misunderstood condition affecting women: endometriosis. While the exact cause of endometriosis remains elusive, several theories are being investigated. These include retrograde menstruation, where menstrual blood flows back through the fallopian tubes and into the pelvic cavity, genetic predisposition, suggesting a familial link; immune system dysfunction, which might fail to recognize and eliminate misplaced endometrial tissue, and the potential for endometrial cells to spread through blood vessels or lymphatic systems. Endometriosis is characterized by the growth of endometrial-like tissue outside the uterus. This tissue, responding to hormonal fluctuations of the menstrual cycle, thickens, breaks down, and bleeds, just like the lining of the uterus. However, this displaced tissue has no way to exit the body. This leads to inflammation, scar tissue formation, and adhesions, which can bind organs together. The resulting pain and complications can significantly impact a woman's quality of life. Endometriosis affects an estimated 1 in 10 women of reproductive age, making it a significant health concern worldwide. It can affect women of all ethnicities and socioeconomic backgrounds, although some studies suggest certain populations may be more susceptible. It's important to remember that the actual prevalence may be even higher, as many women with endometriosis remain undiagnosed. The symptoms of endometriosis can vary widely in severity and presentation. Some women experience debilitating pain, while others have minimal discomfort. Common symptoms include chronic pelvic pain, particularly during menstruation, heavy bleeding, pain during or after intercourse, painful bowel movements or urination, fatigue, and infertility. It's essential to note that the severity of symptoms doesn't always correlate with the extent of the disease. Diagnosing endometriosis can be challenging, as there's no single definitive test. A diagnosis typically involves a combination of factors, including a thorough medical history, a pelvic exam, and imaging tests like ultrasound or MRI. However, the gold standard for diagnosis is laparoscopy, a minimally invasive surgical procedure that allows direct visualization of the pelvic organs and enables the collection of tissue samples for biopsy to confirm the presence of endometrial-like tissue outside the uterus. While there isn't a universally accepted classification system, endometriosis is often categorized based on the location, extent, and depth of the implants. Common classifications include peritoneal endometriosis, ovarian endometriosis, and endometriomas, and deep infiltrating endometriosis, which involves tissue extending into the rectum, bladder, or other organs. The stage of endometriosis, ranging from stage I minimal to stage IV as severe, reflects the extent of the disease and can influence treatment decisions. Treatment for endometriosis aims to manage pain, slow the growth of endometrial tissue, and improve fertility. Treatment options include pain medication, hormone therapy, such as birth control pills or GnRH agonists, and surgery to remove endometrial implants and adhesions. The choice of treatment depends on the severity of symptoms, the patient's desire for fertility, and other individual factors. A multidisciplinary approach involving gynecologists, pain specialists, and other healthcare professionals is often the most effective. Currently, there's no known way to definitively prevent endometriosis. However, certain lifestyle factors may potentially reduce the risk. These include maintaining a healthy weight, avoiding excessive alcohol consumption, and engaging in regular exercise. Early diagnosis and treatment of conditions associated with increased risk, such as pelvic inflammatory disease, may also be beneficial. More research is needed to fully understand preventative measures. The prognosis for women with endometriosis varies. While there's no cure, symptoms can often be effectively managed with appropriate treatment. For women seeking to conceive, treatment can improve fertility. Recent research is focusing on developing new diagnostic tools, targeted therapies that specifically inhibit the growth of endometrial tissue, and a better understanding of the genetic and immunological factors involved in the development of endometriosis. Ongoing research offers hope for improved outcomes and a better quality of life for women living with this condition.